everyone can be seated.
All jurors are present. Counsel waive the reading of the roll.
So waived, yes.
At the beginning of the trial, that generally plaintiff presents all their testimony and witnesses and so forth about the defendant, but exceptions are sometimes made. So an exception is being made now because Mr. Hutchinson has a witness he has to call for the scheduling purposes. So, Mr. Hutchinson, go right ahead.
Thank you, Your Honor. Defense calls Dr. Noah Fink.
Back side. Welcome, Dr. Fink. You can just go stand right up in the witness box and please remain standing until I sworn you in, okay? And doctor, if you please raise your right hand, do you solemnly swear or affirm that the testimony you're about to give to this court will be the truth, the whole truth, and nothing but the truth? Thank you. Please state your full name and give your business address for the record.
Noah, N-O-A-H, Fink, excuse me, F-I-N-K-E-L, 205 East Main Street, Huntington, 117.
Okay,
May I proceed, Your Honor?
you may
Okay.
inquire.
Thank you. Good afternoon, Dr. Finkel.
Good afternoon.
Are you a licensed doctor in the state of New York?
I am,
And how long have you been licensed?
1974,
And do you have a particular area of specialty?
yes, orthopedic surgeon.
Okay.
We got a mic, and who's mic?
Orthopedic surgeon.
Okay. And can you tell us about your education and experience in the field of orthopedic surgery? Where did you go to medical school?
Went to medical school at Upstate Medical Center in Syracuse, New York, part of the New York State school system. And then I spent 2 years at New York University Bellevue Hospital as a surgical intern and resident. And then I spent my last 3 years at Mount Sinai Hospital as an orthopedic resident.
Okay. And Dr. Finkel, just as an aside, you had a little incident with your eye today?
I fell over my dog this morning.
Okay. All right. Well, hopefully we won't keep you long. Are you presently affiliated with any hospital?
Huntington Hospital.
Okay. And are you board certified?
Yes.
And can you tell the jury what board certification is?
Yes, board surgery means that you're qualified from the American Board of Orthopedic Surgery, which requires that you undergo standard training, that you undergo standard testing, and that you continue your education. It's a lifelong education process. And if you can fulfill those requirements, you're then considered to have boards in orthopedic surgery.
Okay. And have you held any leadership positions at the hospitals where you work?
Yes, I was chairman of the Department of Orthopedic Surgery for 16 years. I was also chief of staff at Huntington Hospital for about 18 years. I sit on as a board of directors for the hospital, part of Northwell System now, and I'm also on the board of directors of the New York State Orthopedic Society.
Okay. And what does the chief of staff at the hospital do?
Tries to make peace. The individual is there to oversee the quality of medical care. If you're a physician, your role is as a physician. Sometimes the chief of staff is not always a physician or not practicing physician. So it's a question of looking at the role of the hospital in the community. What are we bringing to the community? What does the community need from us? What does our staff do? How does our staff behave? Do they fulfill the mission, which is basically, as Huntington Hospital is a community hospital, do we care for the community?
Okay, thank you, Doc. Do you still presently perform surgeries?
No,
Okay. And when did you stop performing surgery?
I think 1963.
Okay. And do you still presently treat patients?
Yes.
And oh,
Excuse me, 1963?
no.
No, I'm sorry. I was 63.
Okay.
Okay.
I was like, that didn't sound right.
No, whenever that was, you do the math.
Okay. So how old are you now?
81.
Okay. So it's been a while since you did
It's
surgery.
been a while. Yes.
Fair to say that surgery is a bit of a young man's game.
Younger,
woman's.
Younger-ish, yes.
Younger. Okay. Now, have you treated people over the years with knee injuries?
Yes.
And have you treated people with hip injuries?
Yes.
And have you been recognized as in the New York courts as an expert before?
Yes.
Okay. And about approximately how many times have you testified?
Since COVID, I've only been here once.
Okay. And prior to that, you know approximately how many times you would have testified?
I'd say probably twice, maybe twice a year for a couple of years.
Okay. So, any idea of a total number?
I'd say 7.
Okay. Your Honor, ask that Dr. Fick be recognized as an expert in orthopedics.
Allow him to give expert, opinion testimony. Go right ahead.
Dr. Finkel, as a part of your practice, aside from treating patients who are injured, do you also conduct examinations of people who are involved in lawsuits?
Yes.
And how much of your practice is dedicated to treating patients versus examining people who've been in a lawsuit?
I'd say 5% are involved in lawsuit issues.
Okay. And the remaining 95% are just people who come in for treatment from you?
Correct.
Okay. Now, let's go to this particular case, withdrawn. As a part of doing these examinations on behalf of defendants, do you also perform withdrawn? Let's go to this particular case, doctor. At some point, my office contacted you to conduct a physical examination of the plaintiff and prepare a report. Is
Yes.
that fair to say? Okay. And there was a physical examination done,
Yes.
and you issued a report.
Correct.
And do you know approximately when that happened?
April 2nd, 2024.
Okay. And you're being compensated for your time here today. Is that fair to say?
Correct.
Okay. And how much are you being paid for this?
$7,000.
Okay. And now you put in some prior time preparing the report and a meeting with me. You've been paid for that as well?
Yes.
Okay. And so in terms of your fee today, what do you base the fee on?
Well, I had to leave my office. I normally have office hours all day, so I had to leave at 11:30 to get here on time. So basically, it's reimbursement for that time.
Okay. And you talked to me, did we speak before you prepared your initial report?
No,
Okay. Did we speak after that?
sometime after.
Okay. You recall meeting with me prior to today to discuss your report?
I do.
Okay. And do you recall issuing a supplemental report?
Yes.
And you recall why you issued a supplemental report?
Yes.
Okay. Why was that?
I had made an error in my report defining the type of dislocation that the patient had sustained as anatomically incorrect, so I changed that to the correct anatomical position.
Okay. And were there any other changes to the report made?
I think I also had some misinformation about the timing of when her external fixator was removed.
And did you maintain a file in this matter?
A small one, yes.
Okay. And did you bring that with you?
Yes.
Okay. In conducting an examination of a patient, is getting a full, accurate, and complete medical history an important part of your work?
It's probably the most important.
And is that important if a patient is less than truthful or accurate in their medical history, would that affect the outcome?
Certainly could.
Okay. And when the plaintiff in this case came to your office, did you ask her some questions?
I did.
You asked her about her medical history.
I did.
Okay. And did you perform a physical examination?
I did.
Okay. And in evaluating the plaintiff, would you want to know if any prior injuries to the same body part had occurred as they were claiming were hurt in this accident?
Yes.
Okay. Now, in this particular case, you would want to know that the plaintiff withdrawn. I'd like to show the Dr. Finkel what's been marked as Exhibit 3, page 82.
Is the Nassau University Hospital record?
Yes.
So, exhibit, plaintiff's exhibit 3, entered for, I think it was Evans, page 82.
Okay, doctor, that particular page of the exhibit is a report from Nassau University Medical Center, correct?
Right.
And it's dated April 16th, 2018.
Right.
And directing your attention to the bottom of the page, and it relates to the plaintiff, Maurice Hammond, correct?
Correct.
Okay. And directing your attention to the bottom of the page where it says chief complaint details. 55-year-old female with chief complaint of left knee pain. Patient has a history of left knee multiligamentous injury many years ago in Jamaica. Patient was never treated operatively. Do you see that?
Yes.
And did the plaintiff share that history with you?
No.
And would that have been helpful for you to know?
Yes.
And why is that?
Well, we know that she sustained a significant ligamentous injury with this injury in question, and it would be interesting to know what the knee was like before the injury and what role that ligamentous injury in Jamaica might have had in playing on this injury.
Okay, now could a prior multiligamentous injury that had not been treated operatively make someone more predisposed to have a knee location like the one the plaintiff had on August 23rd, 2016?
A knee dislocation.
Knee dislocation.
Yes, it could make her more prone.
Okay. Now, in talking to the plaintiff in the examination, did you ask her about her physical condition?
I did.
Did you ask her about her level of pain?
Yes.
Okay. And something such as a description of pain you would characterize as a subjective complaint. Is that fair to say?
Correct.
And you also, though, performed objective tests when it came to the examination of the plaintiff, correct?
Correct.
And what were those types of tests?
Well, you'd like to see the status of the extremity. Here it's a knee. You'd like to see what the skin is like. Is it swollen? Are the muscles atrophied? Are the muscles intact? Does the knee move? Does it have a range of motion? Does it straighten all the way? Does it bend all the way? Is it relatively stiff or tight? Are the ligaments tight? Is there fluid in the knee? Does the person have a cyst in the back of their knee? Is there any problem with their neurological status or their vascular status in the leg? So those are the issues you're looking for.
Okay. And those tests, the range of motion tests, revealed that the plaintiff had a less than normal range of motion in her left knee, correct?
Yes.
And also in connection with issuing your report, did you review medical records that were provided to you?
I did.
And can you tell the jury briefly what those medical records were?
Yes, I can.
And now, Doctor,
May I
you're
refer
referring
to
to
my
your report?
Yes, may I
Okay.
refer to my report?
Okay.
Yep.
I reviewed some legal issues, legal documents rather, medical records of Joseph Munn, Dr. Munn, CAT scans of her left knee, the operative report of Dr. Munn, medical records from Nassau University Medical Center, other diagnostic studies such as endoscopy, echocardiograms. I reviewed the notes of Richard McCormick, MD, X-ray report from Nassau University Medical Center on July 3rd, 17, employment records, State Department of Health records, emergency ambulance service records, life insurance records, physical therapy records, Good Samaritan Hospital records, more x-rays of the knee, application of an external fixator by Dr. John Cuellar, pronounces Cuellar. MRI report of the knee from 2016, Good Samaritan Hospital records, and some black and white reproductions of the left knee, pictures of the left knee.
And did those records reveal that plaintiff had tricompartmental arthritis of her left knee?
Yes.
Okay. And can arthritis be caused by genetic defects in the knee?
Yes.
I'm going to direct the doctor's attention to Exhibit 6, page 16.
Dr. Munn's records?
Yes, these are the records from Orland and Cohen, Your Honor. And specifically, the CT scan.
Plaintiff's exhibit extension for evidence being shown to the witness, page number 16.
Okay, doctor, you reviewed the CT scan in this case, didn't you?
Yes.
Okay, and
I reviewed the CT scan report.
thank you for the correction. Right. So, and what did that report show?
What's the date?
I'm sorry. The date of the CAT scan is.
9/21/23.
I may have spoken over you. I just want to make sure.
Sorry, 9/21/23.
Okay, September 23. And the finding in that CT scan?
Yes, it notes tricompartmental arthritis within the knee, more affecting the inner side of the knee, but moderate loss of joint space throughout the knee. It also indicated patellofemoral, patella is the button in front of your knee, patellofemoral arthritis, and the area that the kneecap tracks on the thigh bone, on the femur bone, they read it as hypoplastic.
Okay. And is there also evidence of lateral patella tilt?
Yes.
So, back, or just directing your attention to the hypoplastic trochlear sulcus. What is it?
So hypo means less than, hyper means more than. So there, at the end, can I demonstrate with a bone?
Yes. Did you bring a model with you
I have
today?
the bones.
Okay.
Where's the bone, doctor?
Okay, so this is a femur, and this is your hip. So the end of the femur has a groove in it, and that's called the trochlea. And if you put the two together, the kneecap, which is here, rides in that groove. And it's supposed to ride right in the center of the groove, not on the side of the groove or at an angle in the groove. That's the normal.
Okay. So, if someone has a hypoplastic trochlear sulcus, does that mean that groove isn't the way it should be?
It's not deep enough.
So it
It's
should.
flatter.
Okay. And hypoplastic trochlear sulcus, is that something that could have been caused by trauma?
No,
Okay. And what would it be caused by?
it's genetic.
Now, do you have an opinion as to whether the hypoplastic trochlear sulcus existed before the accident in this case?
Just know my objection, Judge. Those opinions are outside his report. He's limited to the four corners of his reports.
Okay. And same for the patellar tilt.
I don't think we got an answer.
Oh, sorry.
I do have an answer.
Any question, doctor?
No. Would you repeat it?
So can you read back the question, please?
Yes.
Question. Now, do you have an opinion as to whether the hypoplastic trochlear sulcus existed before the accident in this case?
The answer is yes, I do.
Okay.
Oh, I'm sorry. And the same for the patellar sulcus.
I do believe it pre-existed the injury.
Both of those, Brady?
Both of those.
Okay. I'd like to show the witness page 128 of Exhibit 1, please.
Plaintiff's exhibit will be entered for evidence and shown to the witness, page number 1.
Okay, and Doctor, that's a MRI report dated 8/26/16 from Good Samaritan Hospital. Do you see that?
I do,
And that's approximately 3 days after the accident, correct?
yes.
Okay, and directing your attention to the lower part of the page where it says patellar retinaculum are intact. Could you read that paragraph?
Yes, patella retinaculum are intact. That refers to the ligaments on either side of the kneecap. Articular cartilage, meaning the cartilage surface behind the kneecap, evaluation is limited by technique and motion artifact, although is a suggestion of at least mild patellofemoral chondromalacia, which means softening of the cartilage in the back of the kneecap.
So that condition, the softening of the kneecap, would that have been created by trauma
In this situation or in general?
in this situation?
No.
Okay, and why is that?
Well, that's a long-standing issue. The cartilage gets soft behind the kneecap because of the maltracking of the kneecap and the alteration in that sulcus, the groove. So it's like you're having a tire in your car that's not aligned. Why do we get our tires aligned? Because the tire is going to wear. So that's what happens to the cartilage in the back of the kneecap.
Okay, so fair to say that this condition didn't happen as a result of the accident, correct? Okay, and does this condition, the patellofemoral chondromalacia, does it relate to the hypoplastic sulcus?
Yes.
And why is that?
Well, because it doesn't the sulcus isn't deep enough for the patella, the kneecap, to track in it. So it tends to track off to the side. And that wears the cartilage.
And I could show the witness Exhibit 3, again, page 78.
This exhibit number 3, entered for evidence, page number 78, and shown to the witness.
Dr. Direct, this is an X-ray report dated October 3rd, 2017, and from Nassau University Medical Center. Do you see that?
Yes, I think it's July 3rd.
I'm sorry, July 3rd. Thank you for correcting. So, is that same condition, is that present in this X-ray?
It is.
And would it make sense that it would be present in this X-ray?
Yes, it's actually more advanced in this X-ray as in the past because I'll just read this line. It says, as before, subchondral cyst erosions of the undersurface of the patella are consistent with chondromalacia patella. So the cysts weren't mentioned previously, I don't believe. But what happens when the cartilage breaks down is that the normal fluid in the joint breaks through the bony layer and we form bony cysts. We form fluid-filled cysts in the bone.
And that would make that condition is worse than it was approximately a year before when the MRI was taken, correct?
Yes.
So, Doctor, you familiar with total knee arthroplasty or total knee replacement?
Yes.
Okay. And have you ever performed that?
Yes.
Okay. And have you ever performed it with robotics?
No.
And fair to say that knee replacement is a fairly common surgery.
Correct.
Okay. And the technology has improved,
Yes.
and the outcomes have improved.
Yes.
Okay. And has pain management in that type of surgery improved?
Yes.
And what is the goal of total knee arthroplasty, total knee replacement?
Well, the only reason to have a knee replacement is because of pain and loss of function. So the goal of the knee replacement is to get back the person's function, relieve their pain, and increase their ability to walk, ambulate, go up and down stairs, etc., which they were losing because of the arthritis.
Doctor, is it likely that someone could be crippled from a total knee replacement?
Unlikely.
Would it be rare?
Yes, it would be uncommon.
Right. Okay. Now, you reviewed records that dealt with the plaintiff and an external fixator from Good Sam Hospital. Do you recall that?
I do.
Okay. And if we could show, and are you aware that plaintiff requested that the external fixator be removed at a certain point in time?
Yes, I'm aware.
If we could show the witness page 735 of Exhibit 1. You know, let me do this. Doctor, did you read an entry? You know, let's show it. Probably better.
Plaintiff's Exhibit 1, and for evidence, page number 735, being shown to the witness.
I apologize. It should be 36. Sorry. I might have said it. So I wouldn't-
Plaintiff's Exhibit number 1, page
Doctor,
Page 736.
directing your attention to the
don't
entry
have it?
beginning with the
736.
words attending addendum. Do you see that?
I do.
And it then goes on to say, I saw and evaluated the patient. I discussed
Then
him.
goes on to say,
Sorry about that. I saw and evaluated the patient. I discussed and reviewed the resident's note and agree with the findings of the plan of care, except for patient wants E-fix removed, even though her knee will be unstable, and there is a chance of redislocation with possible arterial injury that can lead to severe complications, such as amputation. Do you see that?
I do.
And do you agree with that assessment?
I do.
Now, in reviewing the plaintiff's medical records, I would like to direct your attention back to Exhibit 6, page 13.
and for evidence, page number 14, being shown to the witness.
And this is an Orland Cohen record dated July 13th, 2023. Do you see that?
Yes.
And in that, there is an examination was done of plaintiff's hip. You see that?
Yes.
And in that report, it indicates that she first reported pain in her right hip a few months before that. Do you see that?
Yes.
And based on your review of the records, would that be the first time that there was a report of hip pain in the medical records?
To my knowledge, and he relates to a few weeks.
Okay. So what are the findings when it comes to the hip?
People have upper thigh pain.
Well, let me stop that. Under active problems, it says trochanteric bursitis of the right hip. Do you see that?
I do.
And do you agree with that diagnosis?
Yes.
And what is that? What does that term mean?
Trochanter is the name of the outside of the hip bone. And there's a tendon that runs alongside of it that allows us to basically lift our leg out to the side, called abduction. And it's a very common thing if you have an altered gait, if one leg is shorter than the other. If you walk a lot, sometimes walking does it, where you get an inflammation of that tendon on the side of the hip. And it can present with pain going down your leg, can present as, people think they have sciatica or they need a hip replacement, but it's bursitis, it's just a real nuisance for people.
Okay, along those lines, would that condition necessarily lead to a hip replacement?
No.
And the test that you did on the plaintiff in your office during the exam, did that correlate to this particular diagnosis?
Yes.
Doctor, so do you have an opinion with a reasonable degree of medical certainty about the condition of the plaintiff's hip?
Yes.
Okay, what is that?
I think she has trochanteric bursitis or hip bursitis.
And how would you treat hip bursitis?
You can treat it, first of all, you want to alter some of the activities that the patient might be doing. Ice is actually a really good treatment as opposed to heat. You can inject it with some cortisone, and you can use anti-inflammatory drugs. Rarely in my career as surgery an indication.
Okay. And with respect to the plaintiff's knee, after reviewing the records, your conversation with the plaintiff and the examination, do you have an opinion with a reasonable degree of medical certainty as to whether the plaintiff sustained an injury as a result of the accident on August 23rd, 2016?
An injury to her hip or her knee?
Her knee, sorry.
Sorry. Yes, I do have an opinion.
Okay, what's that?
She sustained a significant injury to her knee.
Okay. And do you have an opinion with a reasonable degree of medical certainty with respect to the current condition of the plaintiff's knee?
Yes, I thought the knee was stiff. It didn't straighten all the way, and it's as far as you would like a knee replacement to straighten. It didn't bend as far as you'd like it to bend. There was no fluid. The wound had healed fine without any complications of the wound. And it was a somewhat stiff knee. I thought she lost her muscle. She had a lot of muscle atrophy above what's called the quadriceps muscle above the knee. So that there were significant sequelae to the surgery.
And do you have an opinion with a reasonable degree of medical certainty whether the genetic issues you described have led to the arthritis that the plaintiff has?
Just know my objection, Judge. That opinion is completely outside of his reports. Completely.
I do have an opinion.
And what's that?
I think the anomaly that we find with the trochlea, the hypoplastic trochlea, and the already present changes in the kneecap result in patellofemoral or kneecap arthritis.
And if we could hand the doctor, I don't know whether it's Exhibit A or Exhibit B. You can hand them both to him if you would.
Exhibits A and B, authentic evidence being shown to the witness.
Now, is Defendant's Exhibit A, Doctor, a letter from Orland Cohen to Mr. Fred Ainsley?
Yes.
Okay. And directing your attention to the third page of that letter, I'd ask you to look at the prognosis of the letter.
Yes.
Okay. And it says there, she will likely require revision surgery in her lifetime. Do you agree with that?
No.
Why is that?
Well, first of all, she's older, not old, but older, and the technology has advanced significantly. The big problem in the past has been that the plastic portion in the middle wears out, and that's being handled very differently. It's being sterilized differently, and I think there are expectations that that will last much longer. And unless she has some traumatic event to change that, it's not necessary to think that she's going to need a revision.
Directing your attention to Defendant's Exhibit B, if you could take a look at that. Paragraph 4, it indicates that, and this is an affirmation from Dr. Munn. I reviewed her prior medical records, which is standard practice in the medical field and relevant to my treatment. You see that?
Judge, just know my objection. Okay, that was in connection with pretrial motions and is completely outside the scope of this witness's opinions.
Okay.
Is there a question?
There is. In your practice, in seeing patients, would it be a standard practice, as you know it in the field of orthopedics, to review all of someone's prior medical records before they come for an appointment?
That would be very hard to do. There's just not enough time to do that. So you try to get an adequate history from the patient, and that, if there's any questions after that, that might lead you, for example, to get an MRI report or to talk to a doctor who had treated the patient if those questions still existed.
Thank you, Doctor.
Okay. Let's do
Oh,
it.
you done? All right. Judge, before I begin, can I look at his file, please? When he brought the court.
Objection?
No, no objection. Do you want to take them?
Just need to, Judge. Huh? Yeah.
No, okay.
Any other back?
Yeah. I just want to pull one page out, if I can.
So which page you pull?
This is, looks like a note regarding Miami report in this yellow highlight.
Show
Mark,
it to the document.
yeah, and mark it, please.
Show it first the document.
Okay, if I could mark that as plaintiff's exhibit 11, please.
If he authenticates.
This one puts a name.
Yeah.
Okay.
Well, it came from his report. No problem. Thank you, sir. Dr. Finkel, what we just marked as plaintiff's exhibit 11 for identification, this came from your file, correct?
Correct.
Okay, so part of your record that you're relying on when you come to court to testify in front of the jury, right?
Correct.
There's a note in highlighting. It says, quote, Dr. Finkel is going to amend his IME report to include some things we discussed the other day. Can he also add reference to these two documents? And it has Mark Hutcherson's name and email address. You see that?
I do.
Was it you who put the yellow highlight on it?
No.
Okay. As a result of this, did you speak with Mark Hutcherson to amend your report?
I don't remember that.
Did you amend your reports in September?
I may have amended them to correct the corrections.
Okay, you amended your report, correct?
I sent a
Okay.
subsequent.
All right, I've marked this into evidence, please, Judge.
Objection?
No.
Okay.
Doctor, your goal is to be fair in front of my jury despite being compensated by the defense. Isn't that true?
Yes?
Okay, when did you first learn of this lawsuit?
Well, I first received the records sometime around, I think I stated the date is April 2nd.
Of 2024,
Yes.
okay? 8 years after the accident, correct?
I
Correct.
say so.
Okay, well, I say so.
Okay.
Not a trick question. And did you understand what the plaintiff's claims were in this lawsuit at the time you were retained by the defense counsel?
Did I understand what the claimant's complaints were?
What my client's claims of injuries were as a result of this accident? Did you understand the nature of her injuries and her claims for being injured when you were
believe I
retained?
did.
Okay. And you have no reason to doubt the integrity of any of the healthcare providers, correct?
Correct.
I'm talking about the emergency room doctors at Good Sam. Correct? You have no question to doubt their professionalism, right?
No, nor did I.
Or the nurses or the x-ray techs, correct?
No.
All right. Or the emergency surgery that she had on the date of the accident, correct?
Correct.
All right, that was a closed reduction with external fixation, correct?
I think it was not, I think the external fixation came subsequent.
Correct. They braced her for a week, but ultimately they put in the
Right.
external fixator, right? And even though you haven't done surgery for 18 years, you have no question, no position to question what Dr. Quella did, correct?
Correct.
And you in your own practice have seen severely injured patients with knee derangements such as this, correct?
Dislocations?
Dislocations. You've seen, yes?
Yes.
And you agree they're exquisitely painful, aren't they, doctor?
Yes.
And they're impossible for a patient to walk, correct?
While they're dislocated? Yes.
Correct. Impossible,
Yes.
right? And post-surgery requires extensive physical therapy. Wouldn't you agree?
I would.
And physical therapy is hard work for injured patients, isn't it true?
Yes.
It's painful, there's a long road to recovery, right?
Yes.
And you agree you're not Marie Sannon's treating doctor, correct?
Correct.
You have zero interest whether her injuries healed or are not healed. You're not her treating doctor, isn't that true?
I'm not her treating doctor.
Okay. And whether she's permanently partially disabled or not, it's not your problem, she's not your patient. Isn't that true?
I would say it's not my problem, because she's not my patient.
All right. And you were just retained by defense to review her records, conduct a quick examination, and render an opinion. True?
Hopefully an appropriate examination.
Okay. Okay, I'll accept your characterization of whether it's appropriate. And you're not here to criticize any of the medical treatment she's received thus far, correct?
Correct.
Clearly, you're not in a better position to evaluate her than her treating doctors. Isn't that fair to say?
Yes.
Okay, and when defense counsel retained you, you were keenly aware of the injuries that's at issue in this case. Isn't that true?
Through her history, yes.
Okay, and you were paid to review all of the records.
Yes.
Correct? All right. How much were you paid to review the records?
I think $400 an hour.
And how many hours did you bill for?
I have no idea.
Do you have anything in your file that would indicate how many hours you billed
I
for?
have no idea.
Could you estimate for us?
3 hours? 4 hours? I don't know.
Okay.
My guess is as good as yours.
Okay. Well, so you were paid $7,000 to come to court, and you were paid $400 an hour to review, but you have no timesheets.
I have no timesheets.
Do you expect to submit a bill for timesheets?
I expect to submit a bill for today.
Okay. So you're waiving, hang on, Mark, I'm with you. So you're waiving the time to review records,
There's probably been a bill sent. but
and you have no
I
idea?
don't- No, I don't know.
Okay.
I don't deal with that.
And you said you testified 7 times in this court, right? You didn't testify, you testified once since COVID. Prior to that, 2 times a year, maybe 7 times you said you testified in this court, correct? Remember saying that on the record?
I do.
Okay, this court, you mean Riverhead.
Riverhead?
Have you testified in any other county?
No.
You've never testified in Nassau County?
I think maybe once, a long time ago.
Okay. Have you testified in any other counties?
I think in Manhattan once, maybe
Okay.
20 years ago, or
Okay.
Brooklyn.
How about Brooklyn? How about Queens?
I don't remember Queens.
You're no stranger to lawsuits, are you, doctor?
To lawsuits,
To
I mean,
being,
to court.
to court.
I don't think I'm really familiar.
All right, but when you said 7 times, that really wasn't fair because it's more than that, isn't there?
Well, if you have the number, I'll accept it.
I asked the questions. If you said 7 times, that's not really fair if it's more than that. Isn't that right in front of my jury?
I said it was an estimate, since I didn't really.
No, you said 7 times in this court is what you said. Okay? Now, you testified in Manhattan, in Brooklyn, in Nassau, you possibly think Queens. How about Staten Island?
Objection, he didn't, I don't believe he testified.
This is cross, Judge. How about Staten Island?
I don't even drive to Staten Island.
I don't blame you. How about Westchester?
Never.
Okay. All right. Were you paid to revise the report?
No.
Okay. Mr. Cuthbertson asked you to revise your report, right? We just marked it as an exhibit. Is that your normal practice, to listen to defense counsel to revise a report before you come into court and testify?
If my report has inconsistencies in it, I will do it.
Did he pick up the inconsistency on the anatomical issue?
We may have picked them up together in a conversation.
Isn't that special? When was it that together?
Special.
Yeah, when were you together? Where you reviewed the anatomical differences that required a revision in your report?
I think after he read my report.
And he said, hey doc, you made a mistake? There's an anatomical revision? Is that your testimony?
No, when I read my report with him, I think that I realized that it was incorrect.
But you don't disagree with the injury, right?
No.
All right. And you don't disagree that this is quite a severe dislocation of the leg, of the knee, correct?
Yes.
And nowhere in your reports did you offer any opinion as to the permanent partial disability as a result of this injury, did you?
No.
Okay. And nowhere in your report did you comment as to Marie Sannon's pain and suffering, did you?
No.
Okay. And nowhere in your report do you comment about the enormous difficulties she faces on a daily basis, minute by minute, hour by hour, day by day. Your report's silent as to that, correct?
I don't think I was requested to do that.
Is that a no? You didn't comment on it?
I didn't comment.
Okay, there you go. Now, this type of injury is not common, correct?
Correct.
Okay, in fact, Dr. Munn testified at 0.2% in occurrence according to the literature. That's pretty rare, this type of a left knee derangement, dislocation.
Yes.
Okay. And you've been practicing orthopedics your entire professional career, haven't you?
Correct.
Do you speak French Creole, doctor?
No.
Wouldn't you agree it's important to be able to communicate with your patient? Isn't that good medical practice?
Yes, it is.
And when defense counsel hired you to examine my client, did he provide you with an interpreter?
I think you were there.
No, I was not there.
Oh, there was an attorney was there.
Did he provide you with an interpreter is my question.
Not that